Welcome to another edition of NutriRebel Red Pill Edition, where we try to appeal to neglected demographics, and there's many of them out there. Many, especially guys. I've seen many desperate guys. It's just pathetic, and they bitch and moan about, complain about the world and women in particular. How no one will pay attention to them, but so they just let themselves go. And it's just like an endless cycle. I see it all the time. They have no idea what to do about their health. They try all. I've seen it. They try all kinds of fads and all these types of things, and the main thing they miss is they're trying to get some kind of measurements, and they think that blood and urine is the only thing. I said no, those are snapshot in time. They're very limited. They don't test many things. So here we go. Here's an interesting topic where we talk about the problems that people encounter at doctors' offices, misdiagnoses and things like that. Unseen health problems.
400 to 160, that is severe deficiency. That is a clear clinical deficiency that you can get brain damage from.
He's talking about vitamin B12. That's just vitamin B12. That's not there's many vitamins and minerals in our body and organ function aspects but he says you can get brain damage from too low B12, and that's true. Very true. And he's talking from Australia. They have higher standards for B12 there. That's only B12 though. Only blood serum.
And that's the operating levels of the majority.
That's it.
A survey from Cleveland Clinic recently found that 55% of men do not get regular health screenings. Yet many diseases like heart disease and other cancers are preventable with regular doctor's visits, as well as healthy life choices. Dr. Mark McIntosh with UF Health Jacksonville is joining us live this morning. Doc, this is very concerning that there are so many men that just don't go to the doctor to get that early diagnosis.
And with all the problems that people encounter at doctor's offices, and you wonder why many people, especially guys, don't go to doctor's offices. When they go, they're complaining of back pain, they get a drug. If they complain of depression, they get a drug. That's the acute orientation of modern medicine. It's modern medicine. That's the reason why it's called modern medicine, because it's based on separating the body into component parts for easier symptom management.
An ounce of prevention is worth a pound of cure.
That's true.
So those health issues that men
they don't do much
address,
prevention.
for example, cardiovascular disease, they have modifiable risk factors. We can deal with their hypertension, treat it, diabetes, hypercholesterolemia. And the sedentary lifestyle is very important to avoid. I think it has been said recently that sitting is the new smoking.
Yeah.
So therefore, getting moving is extremely important.
But these types of advice tidbits that doctors typically give, they're very general. I mean, you could tell anyone to get up and start moving more, but that's not really addressing why many people don't have energy, why are people depressed. It's going to help, but it doesn't address. It's very general. It's just like it's telling somebody to do something when they can't do it.
Men are just not proactive. For example,
they're just not proactive. That's because they must be bad men. I mean, this is what they're saying. Can you tell us why they're not proactive? No.
It said 55% of men, if you surveyed them today, have not had their wellness visit. And basically, men need to do certain things that can really help them and prevent the problems and issues that they have. For example, know your numbers. And what does that mean? Know your height and weight so that we can understand your body mass index. Know if you have high blood pressure. Likewise, what is your glucose level? What are your cholesterol levels?
That doesn't explain why your cholesterol depends what kind of cholesterol, which type of cholesterol, VDL or HDL, right? And just simply knowing a cholesterol level doesn't really tell you much of anything. And you need cholesterol. We were told for decades that it's to avoid foods that don't have that are cholesterol free. No, you need cholesterol. That's your antioxidant. That's one of the factors is that your cholesterol is one of them is cholesterol is antioxidant of last resort in your body. So when you take all these drugs like statin drugs that deplete your cholesterol, what do you think happens to your brain? If your brain is made out of a large amount of cholesterol. Well, you start brain shrinkage and brain deformations. Then you get personality changes. Then you get problems with the brain communicating with the rest of the body properly, especially the gut-brain axis. And what do you think happens?
What is your level of activity? All of those things are extremely important.
They're very general recommendations. They aren't trained in detecting subclinical diseases due to many reasons. Subclinical, what's that? We're going to explore that.
The conventional view used to be that you're either fine or you have diabetes. But now we know there's a big gray area in the middle. Where
that gray area in the middle is subclinical phase of many, not just diseases, but just basically being human. And you want to detect these things before they happen.
someone has a blood sugar problem. And of course, if your blood sugar shoots too high, you can become very manic. And if it shoots too low, you can become very depressed. So very often mood swings are connected with an inability to keep blood sugar levels even.
What is a
Yeah, so there you go. There's now he's going further, and now we have Dr. Berg going further and says subclinical hypothyroidism, for an example, right?
subclinical hypothyroid problem? Well, it's a situation where you have a slow thyroid, but the blood values are still normal. Okay, so if you're just basing this only on blood tests and you're not looking deeper, you can completely miss this condition. Now, there are several really important trace minerals involved in thyroid function. Iodine in making the thyroid, selenium in converting T4 to T3, copper involved in the creation of thyroid hormone. But another one that's not emphasized is zinc.
Zinc, yeah, it's a big one. Underactive thyroid is one of the most common medical conditions, and what they don't tell you at the doctor's office is that underactive thyroid is linked to iodine and selenium deficiency. It is also linked to increased levels of mercury, which is a toxin, because mercury displaces iodine. It is also linked to all other glands of the endocrine system, the adrenals, gonads, pancreas, and pituitary, right? It's just amazing that they don't analyze in the doctor's office. Sometimes the thyroid is underactive because it does not get the signal it needs from the pituitary. Pituitary is in your brain, or because it is working overtime to compensate for weak adrenal glands or weak ovaries or weak pancreas. All these things work together, and that's not something your doctor really talks about, is it? But zinc, he's correct. But zinc.
Zinc is not only involved in the conversion from T4 to T3, but it's also involved in the synthesis of T4, T3, as well as the thyroid stimulating hormone, the hormone that comes from the pituitary down to the thyroid itself. Without enough zinc, you cannot convert these hormones and you can't make thyroid hormones. Now, this really is important if you're getting hair loss, alopecia, things like that. And if you don't get enough zinc in your diet, you can take all of these, take thyroid hormones, but you may not get your hair back. So zinc is very, very important.
And we spoke about this before. Dr. Berg and many other practitioners you can see that they slant toward selling supplements especially on their website and their YouTube channel. And there's nothing entirely wrong with that, but how do you know if you need these things? You need a very low cost service, especially when you compare it to getting sick or going to the doctor's office, to provide a highly accurate estimation, because you cannot take one single blood test or one single hair test or a single tissue test to determine what's going on inside your whole body, right?
The other problem is once you have a hypothyroid condition, you're going to have a hard time absorbing zinc. So the fact that you have a slow thyroid causes more of a zinc deficiency. So to make this simple, if you have any thyroid symptoms, don't forget about zinc.
The first thing you need to know is that blood work doesn't work.
Yeah, this guy, Felix Harder, he's talking about the limits of blood testing. It's very limited.
The reason for this is that nutrients are stored in the tissue, not in the blood. For example, less than 1% of magnesium is actually found in your blood. 99% are in the bones, teeth, and soft tissue.
Yeah, and now this following MD, she's an MD, it tells us why you should not trust your lab's reference ranges. Like when you get blood work, how do you reference ranges? It tells your doctor if it's normal, if your blood work is normal or not. And blood work is already limited on its own, but she tells you more. It's just, it's unbelievable what we're...
I'm going to talk today about the overall problem that we have with lab tests when we are trying to explain them to you and how it relates to your situation. Lab tests were always meant to be given to a doctor to interpret, and there are several reasons for that. That partially is because the doctor should interpret it in terms of you as an individual, not you as every person who's out there. And the doctor should interpret it as to healthy normals versus average for the population.
If you're looking at reference ranges,
Yeah.
that's not what you want to look at. You don't want to look at a reference range for the average.
Yeah, that's exactly. How do you know if that's, even if you, when you do get blood tests, how do you know if that's accurate or not for you? You don't know, because everyone's different. They basically, in the medical system, they treat everyone as statistical average. Yet you're still having all these symptoms. Well, we wonder why,
Because the average person is sick. The average person is unwell. And so a lot of people are actually nutritionally deficient and they don't even realize it, right? So here in Australia, if you get your B12 checked, the reference range generally is around 160 to 620, 630.
Yeah.
And that's normal. Okay, so that's the normal
Pretty low
range.
though, right?
Below 400, you get neurological damage.
And I had that. He's only talking about vitamin B12, only B12, not vitamin C, E, all these other vitamins and minerals that are in your body that your body needs, the foundational elements to make you, right? I had that problem, and I was probably got brain damage and neurological damage. Oh yeah, definitely. When I was younger too, I had what do you call it? Scoliosis, mild curvature of the spine. I wouldn't doubt that contributed to it. Of course it did. Yeah.
And demyelination of your nerve cells. Yeah. So how is that normal?
Yeah, it's not
Right. So 400 to 160, that is severe deficiency. That is a clear clinical deficiency that you can get brain damage from.
And he's saying that most people in the world are walking around with that deficiency, and we wonder why people are acting the way they do, why they're getting sick the way they do. Especially when you see all these people committing, they're being called mentally ill, all these types of things. They're on drugs because they're not getting this, they're not getting these problems rectified, and they have brain damage. It could be temporary, it could be permanent.
And that's the operating levels of the majority.
That's it.
So what is the solution to estimate or test your bodily systems in a very low cost way? There's several ways, more than several ways. Hair tissue mineral analysis, blood work.
Testing nutritional status, the ultimate cheat sheet, what I say is if you don't have the money for the comprehensive testing, you focus on the things that are free. You do the dietary and lifestyle analysis. You do the symptom analysis. And then you go to the things that indicates is most probable, and then you do the best validated tests.
Yep. The foreground is our included frontline symptomatology panel he speaks about, along with many other measurable factors and observations. It produces a highly accurate estimation of your major cell nutrition and organ function status. And I'm not trying to sell something here. Like everyone's trying to, everyone has to have a job, right? This is what I'm specializing in now. And these things are very low cost. And I even try to train you on a basic level how to take care of your own health so you don't have to keep coming back, because that's what so many people are used to, is thinking that I just want you to keep coming back. No, I would love that, but that's wouldn't be ethical, right? So I'm trying to, therefore I'm trying to train you in a basic way to take care of your own health.
Anonymous says, what do you think of alternative testing like hair mineral analysis or SpectraCell?
Yeah.
I'm against SpectraCell on the basis that it's not validated. Hair mineral analysis, I like hair mineral analysis when there's nothing better and more validated.
So hair tissue mineral analysis is an optional method that, if you need it, can be used to correlate to the frontline nutritional symptomatology assessments that we provide for a more holistic picture of your health. And there's the word holistic again. I say a systems biology picture of your health. That's only if you need it. I'm not trying to sell these things. Many people think I'm trying to do that. No.
And so For a lot of the trace minerals where we don't have good validated markers of nutritional status, I think hair mineral analysis is good. And I think hair mineral analysis is also good if you don't have the money to do something comprehensive. We have tons of quantitative data saying, like, the normal range is this, the optimal range is this. And so you lose the precision when you go back to the hair mineral analysis. So I wouldn't use it. You have to be careful that if your financial resources are constrained, you might want to do the hair mineral analysis on that basis, but it might be a better financial decision long term to hold on to that money and do free stuff.
Like we do, yeah, or very low cost. Nothing's free. I mean, but I do try to, like I said, teach you on a basic level how I conduct your assessment. That way you can start to more understand it, and maybe even take the course that I did. Who knows if you want to do that? But I mean, this took years for me to do, right? Many people think it's a week-long course. I said no, but many people do that sarcastically in a sadistic way because they're trying to mock me. I've already had that before.
And
yeah,
400.
Yeah. Therefore, I encourage you, check out the free symptom measure tool at the bottom left there. It's free. It's no obligation to see what your potential cell nutrition imbalances would be. And I'm trying to reach, like I said, the desperate demographics, especially men out there. I've seen many of them. My father, people around me, I see them all over the place. They're confused. They have no idea what to do. So hey, it's worth a shot.